Now to another crisis beginning to spread through Indigenous communities across Canada. They were largely shielded from COVID-19 in the spring, but reserves are now reporting the highest number of active cases since the start of the pandemic. Mike Le Couteur reports on what's driving the spread and what's being done to try to contain it.
From the outside, it's a nondescript building in Prince Albert, Saskatchewan. But a service inside the Full Gospel Outreach Centre is being linked to at least 25 cases of COVID-19. Many in attendance were from surrounding First Nations communities, and it's helped to push the total case count in Indigenous communities to 209.
I think the highest that we've seen it to date at any date. And so it's very alarming.
Especially because of how well Indigenous communities fared during the first wave. But now the curve is bending up. The biggest concern is how the virus can spread quickly in multi-generational homes and the fragility of the healthcare system in the north.
You know, if Montreal can get overwhelmed, the healthcare system in Montreal can get overwhelmed. Certainly a small remote community, fly-in access, can easily get overwhelmed as well.
It's why a chief of a First Nation in northern Saskatchewan ordered a lockdown of her community after a spike in COVID-19 cases.
We have a high population of elders in our communities, those with compromised immune systems. So we're really concerned because it's a serious health threat.
An even bigger threat, according to Indigenous Services Minister Marc Miller, is the lack of trust Indigenous communities have in the healthcare system, especially after the world saw what happened to Joyce Echaquan in a Quebec hospital. It's why he's convening a meeting on Friday with the Minister of Crown Indigenous Relations and First Nations leaders to start the process of eliminating systemic racism in Canada's health system. Donna?
All right, Mike Le Couteur, thank you.